Hey guys, welcome to this episode of The Rachel Cruze Show. So today we're going to talk about something that's kind of confusing, but stay with me because it's very important. Getting health insurance when you're self-employed. So if you work for yourself instead of a company, what are you supposed to do about health insurance? Do you really need it? Let's answer all of those questions and more, and stick around to the end because you do not want to miss these money-saving tips for self-employed health insurance. Okay, do you really need health insurance if you're self-employed? Yes, everyone needs health insurance. If you have a medical emergency, you have to have a way to pay for it, and it can be very, very expensive.
That's attractive.
Now, self-employed health insurance is just individual or private healthcare coverage that you can buy for yourself and your family on the government's health insurance marketplace. So this only applies if you do not have employees. If you do have employees, there's different rules for health insurance. So here are a few options on how to get it. Health insurance marketplace. So the government's health insurance marketplace is where you can find out if you qualify for Medicaid, tax credits, or lower health insurance premiums. And if you have kids, this is where you can enroll them in the Children's Health Insurance Program if you qualify. So just go to healthcare.gov to learn more about the marketplace. Then there's private health insurance. So some insurance providers have plans specifically for self-employed people. So shop around and look for a plan that offers a wide range of benefits like access to in-network providers, annual checkups, and preventative care. An independent insurance agent can help you find the right plan for you. Now, there are also healthcare sharing ministries. So this isn't technically health insurance, but it's a group of people who belong to an organization like a church or a ministry, and they pool all their money together and use that fund to pay for major healthcare costs for people in the group. Now, there are some restrictions, so do research and make sure that it's a right fit for your family's medical situation before going with this option. Now, this is what Christian Healthcare Ministries is. And these days, every dollar matters, and taking care of your family matters too. And with Christian Healthcare Ministries, you can care for your family's health and bank account. To learn more, go to chministries.org/Rachel. There are also some health insurance options for when you're only going to be self-employed for a short period of time. So there's COBRA insurance that it allows you to temporarily keep the same employer-based health plan that you had at your last job. Usually you can keep that for 18 months, even up to 36 months, but you are going to pay more than you originally did because your employer will not be paying your premium anymore. And this is really expensive. I know people that have had to do this, and again, you pay a lot, but you want health insurance, so if it's what you need to have in the interim, then it's worth it. Now, there's also short-term health insurance, and this usually covers you up to 3 months with lower premiums than COBRA. And you will have high out-of-pocket costs though, and pre-existing conditions usually aren't covered. There's also industry-specific health insurance, and this is a discounted health insurance available for certain professions, usually through a freelancers union. But before you sign up for this, make sure that you're not paying more for this kind of plan versus one compared to a marketplace plan. So how much is self-employed health insurance? Well, this varies depending on a lot of factors. So the average person will pay $438 a month, and the average family will pay about $1,779 per month. And if you qualify for tax subsidies, you may not have to pay as much. Again, check healthcare.gov for more information on that. All right, here are just a few general tips to keep in mind. Number one, look for agencies who can help. So check out agencies like the Association for the Self-Employed that can possibly give you additional support, like discounted plans and HSAs, health savings accounts. Number two, use self-employed health insurance tax deduction. If you qualify, this means you can deduct 100% of your health insurance premiums from your annual gross income when you file your taxes. In order to qualify, you'll need to prove that you have your own health insurance, not a former employer's, your own, and you'll also need to prove your income for being self-employed. Number 3, find a high deductible health plan. So this means you'll have lower monthly premiums. You just need to make sure that you can cover the high deductible when you need to. That's why it's good to have an HSA, because it's a tax advantage savings account linked to a high deductible health plan. The money saved in your HSA can be used to pay tax-free for qualifying medical expenses. It's awesome. Number 4, make sure to work with an independent insurance agent. So use the Ramsey Trusted Endorsed Local Providers program to find a local agent who can help walk you through all of your options and find the best possible rates so that you're not overpaying. They can help make everything a lot less confusing and make sure that you and your family are covered. All right, you guys, I know that was a lot, but it's a really important subject, and healthcare can be really confusing, it can be really expensive. So for you to have all the information possible, especially when you are self-employed, it's really important. Because remember, I want you to take control of your money and create a life you love.